This conference will now be recorded.
Of the last webinar, and obviously this one is going to be recorded as well. So just to show you and see how easily this works, if you click on printed grant application, the working copy will come up. Now at that point in time, I am going to turn the meeting over to Karen and mute my button. So Karen, it's
Okay.
all you.
Thank you, Don. I appreciate that. And welcome to everyone who's on the line. I just want to apologize in advance if you hear me coughing. I do not have the coronavirus. I have an allergy issue. So if I start coughing, my apologies. For those of you who have done the grants application year over year, I wanted to speak to you guys first in relation to the 3 changes that we've made from last year's document. And then if you decide you want to drop off the line, you're more than welcome to. I just wanted to let you know that there's been 3 changes. The first one is question number 14. It relates to some information that COCA wants to collect in relation to apologies. This particular question is asking who we should reach in your organization for the Connect to Camp program. So we continually want to connect the KOAs with the camps wherever possible. And usually it's the camp director, but if there is someone other than the camp director that we should be reaching out to make that connection, we'd like to get that information in question 14. The other new question is question number 25, and this is the one for COCA that I was mentioning. They'd like to know if there's any clinics or hospitals that you're affiliated with. So if you could list those for us in that space, that would be appreciated. And the last item that is new is under question number 62, and it relates to gratitude and us thanking our donors. We continually want to thank the donors, and we've asked in this section that you be able to, where we require it, do posters or thank you pictures with specific sponsor names. So if we wanted to reach out to some of our bigger sponsors like Winnebago or Thor or those Dometic, the bigger companies we're working with, we would contact your camp and ask you to do a special photo shoot or a quick video or a thank you note or something in that regards. So we've added the donor gratitude section in there just to help us thank the donors that we work with. So in relation to the other information within the grant, it is all the same questions as last year. So at this point, anyone who wants to drop off who did it last year is more than welcome. Otherwise, we're going to walk through the document page by page and take a look at the questions. And then if there's any questions at the end, certainly there's a chat box there, or we can get you to unmute and then we can discuss it. So Dawn, for the first page, and I'm going to run through some of these quickly. What's the operating name of the camp? So not your organization name, but the actual name the camp is operating under. Question number 2, what is the legal name of the organization? Question 3, what is your EIN number? In Canada, it's called a business number. So if you're Canadian, put your business number in. And then what is your camp's website address? Question 4. Question 5, do you own or rent your facilities? This we take into account when we are looking at grant awards in relation to size of the amount and what your occupancy costs may be buried in your budgets. Question number 6, what you received last year and what you're hoping to receive as a grant this year. If you're not sure what last year's was, just leave it blank. I can certainly pick it up from my end. But if it is an increase, question 7, if you have increased your request by more than 10%, please put an explanation in there. We have a camp this year that has had a significant increase because they had to change locations, and the rental cost is exorbitant now. So it's important, if it is more than 10%, that you tell us why, so we can take that into account when we're figuring out the amount to award your camp. Question number 8, where is your camp geographically located? So we have an interactive map on our website. We'd like to get the latitude and longitude of the camp, but if you don't have that, we can do it by way of the actual physical location. So if you could provide us with that so that when our donors are looking at where the camps are located on our map, they can see where you are. Question number 9 is if you have an executive in charge of the camp, if you could put that information just in case it's not you, the person who's applying for the grant, and we have to speak to the executive. If you have an umbrella nonprofit organization such as Camp Quality, you would list that information there in case we needed to reach out to them for further information. Question number 7, who should the check be payable to? Some of you could accept a check in the camp's name, but others must have it in the organization's name. So we will use your instructions in number 11 to prepare the check. Then if you do, or when you do receive your check, where would you like us to mail it out to? I believe this year we're going to go ahead and mail as many as possible rather than go through the Connect to Camp because of the current environment. We do want to get those checks out, and rather than have you have to make a one-on-one contact with the COCA ownership, we will likely send most of them by mail unless we get a special request. So if you could make sure we have the correct mailing address for that, that would be appreciated. Then number 13 is actually related to our previous discussion where you are a Connect to Camp. If you're currently working with a KOA, let us know. If you aren't, our goal is to try and connect you over the next year. We've got a team of people who've volunteered to work on those connections over the next few months. And so please let us know if you are not connected, and we will do our best to get that done. If you are connected, let us know who you're working with. And then again, if you're not the person that we should be talking to about connecting, please put their name in number 14 so we can reach out to the right people. Question 15 is if you're currently in a relationship with your KOA, if you can just let us know how it's going. Has it been positive? Are there things that you'd like to suggest we can improve that program? And maybe get some more outreach out to you. So the next section relates to being part of COCA-I. So the most important requirement is in order for us to give you granting money, you must be a member of COCA. Because of the Gold Ribbon program and the best practices and standards, we want to make sure that we can tell our donors that all of the camps we support are receiving education and are part of the organization. Question 17, does your camp currently have Gold Ribbon status? Dawn and I were talking this week, and because of the current environment and the things that are going on, we may not be able to get as many visits done this year as we had hoped. As a result, we're going to change that required status date to 2022. So add an extra year to that requirement. So it's no longer December 31st, 2021 that you have to have your Gold Ribbon accreditation. It will be the following year. Question 18, just let us know what your projected date is that you're planning to get your status. That way we know that you're working on it. And if there's any problems or concerns that you're not going to be able to do that, let us know. Another part of receiving grant funding is that you need to complete the COCA annual survey. So if you haven't done that, please reach out to Dawn and get that completed. We want to make sure that you're providing them with the needed information they need to have on their files in the research. One of our other requirements that we have to receive grant money is to attend either a regional meeting or the COCA conference at least once in the last 3 years. We want to ensure that you're keeping up to date and you know what's happening within the industry, and you're getting peer-to-peer advice and knowledge. And so it is a requirement. If you put no on the next page, we'd like to know why you weren't able to attend. So if it's a financial reason or a time frame reason, not being able to get time off, we'll see what we can do to work around that to ensure that you do get the required education. Question 22, do you belong to any other organizations besides COCA or the American Camp Association? Question 23, have you received any other endorsements other than COCA and ACA? Is your camp ACA accredited? So yes or no in number 24. 25 we spoke of earlier, information on any clinics and hospitals. Question 26 through 31 all relate to COG hospitals. So if you tick yes in 26, we ask that you complete the questions 27 through 31. And if you click no, that you're not associated, then you can just skip through to the end of 31. Sorry, on question, so now we're coming up to the actual section on the details of the camp sessions you're offering. So question 32, please list the age range of the campers, both last year and this year. And do you offer year-round programming? More and more of our organizations are doing more than just the week, so we'd like to know that. Are you a day program or a residential program, or do you do both? And then question 35, how many sessions will you be doing in total, counting everything? The next page, we've given you a little bit more room to write. Questions 36 relate to how many different sessions you're going to have. So hopefully there's enough space there to put each of the sessions. 37 is how many days and nights in each of the sessions. So if you put your date session 1, please put the days and numbers to correspond to session 1 in number 37. And then 38 is how many in total days and nights will your camp operate. So that's totaling everything together. Question 39, how many children with or in remission from cancer did you serve? So this is unique children. So if one child goes to 5 of your sessions, they still only count as one child. Similarly, for question 40, for siblings, if it's more than one session they go to, please just count them as one sibling. Same thing with parents and grandparents. And then if there's anybody else that you have also serviced, some people do aunts and uncles, some people do step parents, that type of thing. If you could put that in question 42. An important one for us, question 43, is if you had to turn anybody away this past year because you didn't have enough space, enough beds to service the requests that were coming in, it's important for us to know how many of those people you had to turn away. So 44, if you could put down, if you answered yes to 43 and 44, please put down the number of people you turned away. Question 45 is operating costs. So here we ask that you've only put the operating costs related to the oncology camps. So if you're doing a camp for, say, diabetes, or you're doing a camp for autism, please don't include those numbers in the operating costs. Our mission is solely to support the oncology camps, and so we need to focus in on numbers specific to those camps. And then question 43, how much of your costs are included in gift-in-kind donations? That lets us know overall what your total costs are, but please do not include fundraising salaries or expenses related to fundraising. And then question 47, what is your average per day cost for a child with or in remission from cancer? 48 of the operating costs above, how much of it relates to actually owning the facilities? So if you could give us an indication if you've included these numbers, we want to make sure everybody's on a level playing field, so we back those numbers out when we're comparing from one to the other. And then what percentage of your camp's budget are you looking for us to fund? On average, our guideline is 10% of your operating costs, which would include gifts in kind as well. So 10% of the operating costs is our goal. We do go a little bit higher in certain cases depending on the situation, but that's the average. And important for us to know is if you're meeting your fundraising goals. So question 50, if you did meet your fundraising goals for last year, congratulations to everyone. If not, if you could let us know how much you fell short. Again, giving us an idea of what's happening in the oncology camp field. And then next section is about information on this year's camp. Question 52, how many camp staff, including counselors, are you using last year and this year? How many of those are paid for their services? 54, how many of your camp staff receive a remuneration in excess of $100,000? This doesn't prohibit you from receiving a grant from us. It just gives us a better idea when we're comparing camp to camp how much we're spending on salaries. Question 55, how many medical volunteers did you have? So doctors, nurses, social workers, etc. And 56, how many non-medical did you have volunteering for the camp last year and this year? Question 57, we just want to track to see how often a counselor comes back. A camper comes back as a counselor. And so in question 57, we're asking how many of your counselors have attended a camp previously as a camper. And as we previously mentioned, we do, our mission is to support cancer camp programs. So we're hoping that under your current setup, you're able to use the funds that we give you for that cancer oncology camp section. Question 59 is the additional information that we require from you, a list of it prior to releasing the funds, your grant check. So if I get the grant and I get all the supporting documents, the checks will be released the beginning of May at this point in time. We haven't adjusted for the current coronavirus situation. We are hoping to proceed as planned with people submitting their applications by April 15th, based on the assumption that they would go ahead with their camps. And full steam ahead as normal. That may change down the road, but we will let everybody know if there are going to be changes. We do have an executive committee meeting next week after the regional town halls to discuss what's happening within the system, so that we have a better feel for what the camps are doing, either to postpone, delay, accommodate, do virtually, etc. So we will have some better feedback for you next week. In the meantime, the additional documents can be sent in to info@koacarecamps.org. And once you send those in, I will send you an email back acknowledging I received them. So if you do send them in and you don't get an email back in a day or two, please send me off a quick note so that I can double check it's not gone into spam or something like that. At this point, I'll give you my cell phone number if there's any questions. It's 800-431-0513. Again, it's 800-431-0513. The next section of the website, the next section of the application just asks some general questions about how you're representing us through your organization. So do you have a link to our website on your website? Are you using our Care Camps logo? If you need that, send me off a quick note at that info box and I'll send you with the logo in whatever format you need it. Are your staff willing to participate in our fundraising efforts? We have several larger donors who are looking for people to come out to some of their fundraising events. So if you're able to participate, we would certainly be happy to get you out to help represent not only your camp, but care camps as well at their events. And then at the bottom of that page is just our comments that I spoke earlier about donor gratitude, and having you help us out with some pictures or videos, or even just writing cards to the donors for specific thank yous to some of our larger donors. So that basically is the conclusion of the operating portion of the grant application. If you have any questions, again, you have my number, 800-431-0513. The next portion relates to capital improvements, and we've always set aside a bit of money to help out with some of those items that will help to improve your program. So such things as walkie-talkies or computers, or in cases we've been able to fund used golf carts or trailers or life jackets. Definitely, we love funding life jackets and medical supplies and things like that. And so if you have a need for those kind of things that would be able to improve your programming, please feel free to reach out. Our average award runs from $3,500 to $5,000. If you need a few smaller things, lump them together and or list them separately. We are happy to look at them. And the maximum that we've ever given out as part of a capital grant is $15,000. So just to give you an idea that we're looking for the smaller items, but in rare circumstances, depending what it is, we can go over and above. We've also been able to reach out to specific donors. So one of our camps needed a ramp for loading horses, and we were able to find a specific donor for that specific item, and we're able to take care of that outside of our average amounts and outside of the maximum available. So do list what you need, and if we can't fund it, we may be able to find a specific donor who might be interested in funding it as well. So 63 is if you could list them in priority order, the first top 3 items, and then explain how they would improve your programs in 64. In 65, what the total cost is, because you may have maybe an extra large one and you're just asking us for a portion to help fund it so that you can get it in total. So what the total cost is and what percentage you, question 66 is what percentage of the funding do you already have? And if you don't have the funding, what question number 68 asks, sorry, my apologies. Question 69 is, would you go ahead with purchasing the capital item even if we weren't able to provide you with funding? And again, the question, do you own your facilities? If we're spending a significant amount of money, we would like to ensure that the item can either be transported or that you own the facility, so it won't be an issue if you move camps to another location. That item would be able to come with you. And last but not least, what percentage do you already have funding available? So that was a quick run through. The application deadline, again, is April 15th. We are hoping to have everybody's application in by then. Our grant committee meets the following week, and we will be getting back to you by April 30th with the grant amounts, with the goal of getting checks out May 1st. Again, assuming that everything continues to move forward and there isn't any major hiccups. And Dawn, I'm going to just open it to you. If anybody has any questions or concerns or feedback, I'm happy to help now.
Sure. Thank you. Thank you very much, Karen, for that. I've got a handful of questions here that I'll pass along. Hopefully my dogs are not going to be barking in the background. Mark Anthony.
Go ahead.
Mark Anthony just wrote a question for question 34. Do the monthly activities, typically just like an 8-hour day, count as programs?
Sorry, 34, is this a day camp or a residential camp? Is that
Right.
the one?
Mm-hmm.
And he wants to know if it's 8 hours, if it counts daily?
Well, yeah, do the monthly activities, typically just like an 8-hour day, count as program? Unfortunately,
Yeah,
Mark
yeah.
Mark left just a few minutes ago, but
Okay. Yeah, no, if they're covering like 7 or 8 hours and it's over, like, say, 4 or 5 weekends, like, a couple hours here or there, certainly that can add up to a day camp. Absolutely.
okay. Tanya from the Good Times Project is referring to question 25, which
Okay.
reads, please provide information on any clinics or hospitals. Her question is, can you define associated? Is this a formal association? We are not formally associated with a hospital in any way, but we work with them to publicize camp to families. How should we answer?
So, Don, that's the question that we added for you, because you wanted to find out how many were associated with clinics or hospitals.
Right.
So,
Tanya, the answer to that is what we're trying to collect the clinics and hospitals our camps work with. Long-term wise, what we want to be able to do, especially given the Gold Ribbon program, is at some point in time begin promoting the Gold Ribbon program to these hospitals and clinics you're affiliated with. The idea, is to, support our camps, right, to these hospitals. So the answer is associated. If you draw campers from a hospital, uh, the answer is yes. Please put the information in there. So I think that might answer it. A question from Shannon says this. Given current circumstances, we are not certain what our camp dates will look like for 2020. If we are not certain, how should we handle the question regarding camp session dates?
I would put down or indicate, if the coronavirus wasn't here today, what you would expect it to be. So I would normally, for example, we normally do the third week of July. Put that down as your camp date. It's not set in stone. If it changes, it's not a problem, but at least we know you're having a session during that time frame, or anticipating having a session. So put down as if you were going ahead full steam and running a program.
Wonderful. Mark Anthony has another question, and that is for operating costs. Do you want us to include adult programs as well as children programs?
If you're applying for a family camp, it would be included. If you're applying just for the kids camp, then no.
Okay. And then let me see, the last question here is from Tanya. Good Times, right up in the Seattle area, I believe. If we're choosing not to audit, is it okay not to include that in supporting documents?
Absolutely. Not everybody has an audit completed, so that's just fine. If you don't have it, when you send me the information, just say we're not required to have an audit, and that doesn't hinder you from getting funding.
Okay. Well, for right now, unless another comment shows up, it looks like we pretty well covered that. Let me go back here for just a minute. I am going to unmute everybody in case you want to. If anybody out there has a question you'd like to ask Karen directly, please feel free. I've got a short attention span, so Karen, I know from my standpoint, from COCA standpoint, and I can guarantee you from every one of the camps that are currently on this call, we cannot appreciate, the amount of appreciation. We can't express the amount of appreciation and the wonderful nature of the collaborative relationship we have with care camps is just beyond comprehension. So thank you very much. I know that everybody wants to wish you to stay healthy and safe. and we're all looking forward to having a wonderful camp season this year.
Awesome. Well, good luck to everyone. I hope everything works out well and that we are going to be able to go ahead with the camps. That's why we're hoping to keep focused positively and full steam ahead. However, as things change, we will certainly be adjusting based on the situation, and we completely understand. We've already had notifications from one of the camps that they've had to shut down. So they're going to try putting in place a virtual camp experience for the kids. And we completely understand in this unknown time that we may have to accommodate and make changes to what our real world has been. So we're going to try our best to be there and help out and accommodate as we can. So thank you to all of you for your patience and for all you do for the kids. We truly appreciate it.
One last question, just to clarify, Karen, I think I know the answer, but it came from Deb at Acton Camp. We're planning to have camp. If that changes with the coronavirus, will monies need to be refunded?
And that's a very good question. Our executive committee is meeting next week, and we'll be discussing that. But my thinking is that most of the camps won't completely cancel, in that they'll try to make other arrangements or do other things to reach out and keep in contact with the kids. And so with the hopes that other accommodations can be made, that we wouldn't ask for the money back.
Okay.
That would be my gut instincts as to where the executive committee will go. If that changes at all, we'll certainly let you know. But again, I do believe that from the heart of the directors, they're going to make every attempt possible to try to put some type of programming in place, and that's going to cost money.
I could guarantee you that's going to happen. Well, thank you for your time, Karen, and please stay safe and healthy for us all.
You guys too. Take care.
All right.
Okay. Take care. Bye-bye.